Hello guys, I am going to talk about CPR, which stands for Cardiopulmonary Resuscitation. So when someone goes into cardiac arrest, blood flow stops to the brain and heart. Therefore, to increase an individual's chances of survival, CPR needs to be started immediately. Okay. Say you find someone unresponsive, say a family member or friend. First, you want to check for breathing. No breathing or gasping, which is not breathing. Next, you want to check a pulse. Don't waste too much time trying to check for a carotid pulse. Just move on, start doing CPR. Okay, so no breathing, no pulse. You want to start CPR and get help. Call 911 as soon as possible. Okay? Important facts to remember while providing CPR. You want to most definitely minimize the interruption while you're doing chest compressions and breath. So you want to just minimize any interruption while providing CPR. CPR is effective on a hard surface, such as a floor. Compressions to the lower half of the sternum. You want to make sure that your hands is in the right position while doing chest compressions. You want to place the heel of one hand directly on the center of the chest, with the heel of the other hand on top of the first hand with your fingers interlock. This position is important to maximize the benefit of chest compressions. While doing the chest compressions, you want to allow the chest to recoil between each compressions. This allows blood flow to the heart. So these are all some important tips to remember while doing CPR. Additionally, you want to provide compressions at a rate of 100 to 120 per minute with a depth of at least 2 inches. CPR ratio is going to be 30 compressions to 2 breaths. All right, now we're going to talk about the breath technique. You want to have the person's head in a head tilt, chin lift position, right? Technique to deliver breaths. You want to pinch the nose and deliver 2 breaths. Remember, it's 30 compressions to 2 breaths. You want to deliver each breath over 1 second, and this prevents air from entering the stomach. So how do you know that your breaths are effective when you're giving breaths to someone? The chest should rise with each breath. If you're giving a breath and you notice that the chest did not rise, you want to reposition the person's head tilt, chin up, and then you want to proceed with the breaths and watch for the chest to rise with each breath. This is how you know that your breaths are effective, and this is what you want. Remember, the goal in CPR is to increase the person's chances of survival. So you want to make sure that your technique is correct. So doing CPR, you want to check for the pulse every 2 minutes. But remember what I said. Don't waste time if you think, oh, did I really feel a pulse? Am I getting a pulse? You don't want to waste time checking for the pulse. If you find a pulse and the person is still not breathing, you want to stop the chest compression and give rescue breaths. So after you did all of that, right, all of your work was effective. Thank you, Jesus. And you notice that the person is breathing and there is a pulse, you stop CPR completely. No chest compression, no more breathing. And you just watch that person until help arrives. Okay. Important points. You never want to stop CPR. You want to keep performing CPR until another person comes to help, or until EMS or someone else come. You never want to just say, okay, I've tried, I'm just going to stop. You just keep doing the CPR until another help come to help you or to transport the patient to the hospital. Remember, this is your loved one. This is your friend. This can be a total stranger. Okay? So, yesterday I did my CPR class and I went to this place in NEWNAN, Georgia for the first time. It's called First Response Safety, and the instructor was Jeff FELMET. Very good instructor. Class went smooth. Teaching was effective. He provided all the important points that you need to know and remember as someone providing CPR to someone who is in cardiac arrest. So, first response safety, this guy comes highly recommended. So I'm going to put his information in the link below. And if you know someone or you are in need of a CPR class, please don't hesitate to call him. Okay? So until next time, guys, I will see you. Take care of yourself and be safe. And just remember these important facts. If you was ever to experience someone going into cardiac arrest, I wish you don't, but always remember what's the most important thing. You always want to do what you need to do to increase that person's chances of survival. Most important, right? Bye.